Hi everyone, I'm Mark Ames. Welcome to 5 on the Front Line, produced by AIHA. This week we're solving a problem that has a lot of people worried: how to stay safe in an office during the pandemic. Our guest today is Corey Boles. Corey is a senior health scientist with Cardno Chemrisk. His primary area of expertise includes industrial hygiene, aerosol science, and microbial exposure, and he's a member of AIHA's Biosafety and Environmental Microbiology Committee. Corey is also an avid scuba diver, being certified in advanced open water diving by PADI. When he isn't working and quarantining due to COVID-19, he is actively diving and volunteering with nonprofits to help clean up waterways. Welcome to the show, Corey.
Thanks, Mark. It's a pleasure to be here.
Corey, increasingly people are talking about going back into the office during the pandemic, and they're scared. What key piece of information are office workers missing that will help protect them from COVID-19?
Of course. Thanks, Mark. I'm happy you asked that question because it's one that we get often, and it's a really great one to ask right now. I first want to start off with saying that, when it comes to risk management and controls within the workplace, that it should really be a multi-layered approach so that there is really no single point of failure. Really meaning you don't want to rely on any one intervention. So don't simply just rely on face coverings, or don't simply rely just on ventilation. It should be a combination of everything: face coverings, ventilation, physical distancing, cleaning and disinfection. Of course, these are the fundamental and basic guidelines that the office then tailors off of that to their unique operations. I also want to emphasize that in contrast to chemical and mechanical hazards, infectious diseases are mainly driven by humans. It's a huge human factor that's involved in transmission. Therefore, when it comes to controlling that spread, everyone has a role to play, from leadership and management all the way down to every single employee and vendor that they may employ within the office. Having said that, it's important from the get-go, whether it be reopening or just returning to work or already working because you're essential, that leadership and management be on the same page. They have a consensus, they're in agreement with how they should move forward, and they're checking in regularly with their employees and their workers. And that also translates over to a communication framework. So something that's developed early on to provide clear and concise information that's pertinent. In addition, it recognizes the workforce. So are there cultural and linguistic barriers in place, and how do they plan to overcome that when it comes to communication? In addition, are there any technological barriers? So people that might only have access to text messages or phone calls and not emails. Multiple forms of communication and a common source for the policies and guidelines in place are crucial, because confusion can lead to an increased risk. Increased risk can lead to transmission, and that's the last thing that we want. In addition to all of those, of course, keeping in mind this entire time that reopening is just one part of an infection control or risk management plan. Just because you reopen doesn't mean that the risk is gone. The risk is still there. We're in the middle of a pandemic, so we're just trying to reduce it as much as possible, reduce that transmission at the workplace. Working closely with your facilities management and building engineers prior to reopening to make sure the building is safe. We've been under quarantine for a while. A lot of these offices have remained dormant. Legionella, mold, pest infiltration, structural damage, all the recent Hurricane Laura or wildfires. There might have been damage to buildings. The AIHA has put out a bunch of really great documents right now for returning back to work safely and investigating these indoor environmental quality considerations: mold and Legionella, structural damage. In addition to that, when it comes to the actual office setting, there's a few approaches. Discouraging gathering in communal areas. You don't want to group together, and if it's necessary, it needs to be in a well-ventilated large office that still limits the number of people that are in there. Bring your own lunch. It seems simple enough, but it can go a long way. Ride to work in your own car if you can. That's a really important one. If you need to take a ride share or you need to take public transportation, once again, AIHA has a really great back to work safely guidance document for those. And then it's important to make sure that you keep in mind that the team consists of multiple people, and you keep in mind your psychological health during this time.
Corey, that is fantastic. Thank you so much for coming on the show. That is all the time we have today. Thanks so much to everyone for joining us. This has been 5 on the Front Line. I'm Mark Ames. We'll see you next week.